We talk about theories now. Let's get a little bit out of history and talk about the theories that maybe have been slightly mentioned in our conversation before now. And one of those is neurobehavioral, and that's Dr. T. Barry Brazelton. Remember that he discusses the importance of the autonomic motor state, attention, interactive, and self-regulatory systems. Many of us are very, very familiar with his work and with the care of full-term newborns. But you know, we're also seeing that many of the things that he has given us in that theory applies to our preterm infants. So I think that when we're looking at deep sleep and light sleep, and we're looking at that drowsy or semi-alert infant, we then look at, of course, whether they are alert. And if they are willing to interact with us, their eyes are open. And then, of course, we also look at the crying state of our infants, how all of those intertwine and how they can all be applied to our preterm infants. We then move on to the fact of Dr. Alls and the synactive theory of growth and development. Remember that she started doing her publishing back in 1986. And speaking about Dr. Alls, we know that the environment that she's trying to create is that continuous interaction between the infant and the environment, and how this truly plays into the fact of both our short-term and our long-term outcomes with our infant. You know, Dr. Alls has also given us the NIDCAP training, where we are training, staff, individuals to come into the unit to do assessments of our infants and to show how we can create the environment interaction with our infant and see that our environment does impinge upon our infants, and what do we do to change that environment. And it's a wonderful educational opportunity, both for those individuals that become NIDCAP certified, as well as for the staff that they interact with every day. Now, let's take a look at a couple of other theories. One of them is the transactional theory, and that's by Dr. Samaroff, and he talks about the fact that there are intrinsic factors that play a part in the growth and development of our infants, and that looks at gender, it looks at gestational age, and it looks at birth weight. He also looks at environmental factors as well. So we have to take and look at and consider the fact that that is a very plausible theory when we're looking at our neonates. And then, of course, we look at Virginia Wiley. And I love Virginia Wiley's theory because she talks about the coping theory and how we are all stressed and how we need to learn how to cope with those stresses, and that we need to use self-regulatory behaviors to do that. And I think that, you know, as nurses, we can relate to Virginia quite well, considering that she is a nurse herself. And then, of course, we take and we look at Dr. Peter Gorski, and he talks about those behavioral cues and the fact that there are, you know, behavioral distress cues, there are little subtle physiological stress cues, and the fact that there are gross distress cues, and that if we take and monitor the cues, and we look for the cues, and we help our parents to look for the cues, that we can better help our infants to deal with some of the input that they are receiving. One of the things is the fact that if we start seeing our infants, you know, grimace, or if they start to cry, what are the problems? Where did it come from? How can we take and to help this infant to learn how to handle himself, and how do we respond to this infant so that we are better suited to keep him from getting into some very gross distress cues. And then, of course, we look at those foundations for developmental care. And when we look at foundations, we're talking about 5 topics, and that's organization, we're talking about regulation, we're talking about homeostasis, we're talking about competence, and we're talking about system. And if you read any articles on developmental care, you're probably going to find one of these words in every one of those articles, because of the simple reason that when we are taking and looking at organization, we want our infants to be organized. We want them to be able to get into that midline physiologically flexed position. We want them to be able to put their processes together, and we want them to be, you know, they can't count to 10 like we can. They can't say, hold it, stop, give me a minute to take a breath. They can't do that. So we have to do what we can through our management and our care practices with our infants to help them maintain organization so that they can function as a whole. We also have to look at regulation. how, are they stabilized in the environment? How are they relating to the environment? What can we do to promote that state of equilibrium? And that's what we really want to have for our infants. Then we look at homeostasis. We want our infants to be able to respond in a very capable way. We want them to be able not to compete with the environment, but we want them to be a complete integral part of the environment, and that there is homeostasis present. We've done organization, we've done regulation, we've done homeostasis. So let's talk about competence now. Okay, our infants were competent in utero. They were completely in charge of their environment, so to speak, or that they worked very integrally with the environment. And so therefore, we need to try to do whatever we can in order to be able to allow our infants to be competent when they're here. Remember, in utero, they had the amniotic sac. They had the intrauterine wall, and so therefore they were very, very much in control, and therefore if they stretched and then, got in a little bit of extension and were feeling that uterine wall, then they could come back into flexion because they received that. So therefore, they were competent in what they were doing. And then, of course, we have to then move on to system. Okay? And our infants function as a system, and so therefore we need to help them to maintain and to work with all of the systems that are present in order to create that environment that they so desperately need during this critical moment of growth and development. And then, of course, we have the communication theory, and that comes to us from Linda Frank and from Gretchen Lawhorn, and that is the fact that infants' behavior is their main channel of communication with us. That's why it's so important that we are very observant to their cues, because that is part of their behavior, and that's how they communicate with us and let us know when they are in stress. So therefore, we need to take and help them to establish communication and be ever vigilant in what is happening and what they are portraying to us. And then, of course, we look at the newest theory that's out there, and this comes to us from Sharon Gibbons, Steve Hoth, Mary Coughlin, and Linda Frank, and they are talking to us about the universe of developmental care. And that's sort of a new concept, and it's a new application for what's happening out there in the NICU. And they are looking at it as being maybe the first reformulation of what Dr. Alls was creating when she brought up the synactive theory of growth and development back in 1984, 85, and 86. So, but what they're looking at is the fact that developmental care is a shared surface interface that is central to this type of model. And they're using as their central interface the skin. And they're looking very, very much at the fact of how the tactile system and how the skin, which is ever encompassing of our infants, actually play a part in how our infant responds, and that how he reacts to certain things that are happening in the environment. So therefore, we really need to take and look at this, because it's looking at a new neurodevelopmental factor when we're looking at our caregiving practices, because we are using the skin as our main interface. And so therefore, because touch is very vital, touch is a means of communication. And I think we have to really explore. And this, universe of developmental care actually is very intriguing and very interesting. And I think we have more to come from this avenue. So I think probably we all need to stay tuned as to what's going to be happening with this approach and the universe of developmental care.